Fellow EB members, turning to this session of the board, I'm acutely aware of the substantive and complex agenda that we must cover between now and Saturday, made even more challenging by the shortened duration for the EB this year. As I mentioned in my inaugural address as board chair, I will continue to rely on your collective support, wisdom, and cooperation in order to ensure the efficient and smooth running of our board meeting. In relation to the pressing health challenges of our time, I urge the EB to spare no effort in making decisions that will positively contribute to bringing an end to the ongoing pandemic and secure a healthier and more sustainable future. As I conclude my remarks, I wish to convey the board's appreciation to Honorable Nicholas Steele, Minister of Health, Social Security and International Business of Grenada, and Chair of PBAC, for his very able leadership and steering of the PBAC discussions last week. The board looks forward to receiving the PBAC report, including its recommendations, this week. I also wish to thank the Director General, Executive Director for Governance, as well as the GBS and legal teams for their professionalism and support in preparing for this meeting. I look forward to our fruitful deliberations during the coming week, and thank you once again for your participation. In the context of the restrictions imposed in response to the COVID-19 pandemic, the Executive Board has approved the arrangements for a hybrid meeting of the Executive Board to be held. I have particular pleasure in welcoming all the Executive Board members and their alternates and advisors who are joining this meeting in person and through the virtual platform. I should like to address a special welcome to 8 new members of the board. From Colombia, Mr. German Escobar Morales. From Guinea-Bissau, Dr. Agostina Mbako Ndomba. From India, Mr. Rajesh Bhushan. From Madagascar, Professor Zeli Arivelo. From Malaysia, Kairi Jamaluddin. From Peru, Dr. Hernando Ismael Flores, and from Tonga, Dr. Sai Mai Piukala. And finally from Tunisia, Professor Ali Mrabet. Unfortunately, Dr. Sai Mau Piukala from Tonga is unable to participate in this session of the board due to the recent unfortunate events that have occurred in Tonga, which I addressed in my remarks. Dr. Sai Piukala was due to participate on Wednesday, 26th January, with in the Dr. Lee Jong-wook Memorial Prize for Public Health Selection panel, in accordance with Article 6 of the statutes of the prize. And under agenda item 22.3, foundation committees and selection panels, in his absence, I propose to have him replaced by Dr. Hiroki Nakatani for the purpose of this specific meeting of Dr. Lee Jong-wook Memorial Prize for Public Health. I've also been informed that Dr. Wahid Majrooh from Afghanistan is not present for this session of the board. Dr. Wahid Majrooh was due to participate on Wednesday, 26 January, in the Nelson Mandela Award for Health Promotion Selection Panel. And in accordance with Article 5 of the Statutes of the Award, and under Agenda Item 22.3, Foundation Committees and Selection Panels, in his absence, and in line with my previous proposal, I propose to have him replaced by one of the vice chairs for the purpose of this specific meeting of the Nelson Mandela Award for Health Promotion Selection Panel, and will consult with the Bureau on this matter. Are there any comments on these two proposals? I see none. It is so decided. I would also like to cordially greet representatives of member states, observers, the United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations, and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. I would also like to welcome our colleagues who are following the deliberations of this meeting. Special procedures. To regulate the conduct of this hybrid meeting, we shall now take up the draft decision contained in document EB 150/2 concerning the special procedures to regulate the conduct of this hybrid session of the Executive Board. May I take it that the Executive Board is ready to adopt the special procedures contained in document EB 150/2 and to apply them to this meeting? I see no objection. The decision is therefore adopted. The special procedures set out, among other things, how delegations may address the meeting. In addition, please note that, as in a physical meeting, within member states' delegations, the matter of authorization to take the floor is a matter for the delegation itself. Accordingly, and in line with the normal practice, if an alternate or an advisor who has been duly registered as part of the delegation presents themselves to speak or vote on behalf of a delegation, it will be assumed that they are authorized by the delegation to do so. In terms of procedural motions, member states wishing to raise a point of order or exercise a right of reply should do so either by raising their nameplate if the delegation member is physically present, or by sending a message to the telephone number by SMS, text, or WhatsApp, +4179 467 2870. The number is the same that member states used during other recent governing body meetings, and it may be used for points of order, requests for rights of reply, or other procedural motions only. It may not be used for any other matter. The telephone number can also be found in the practical guide for decision-making and procedural issues on the virtual system contained in document EB 150/INF/1. In addition, I would like to make clear that I propose to accord the right of reply, if sought, at the end of each day. Delegates are kindly required to keep their interventions as brief as possible, and in the interest of time, it would be appreciated if interventions could be limited to up to 2 minutes. May I take it that the board is content to proceed on this basis? I see no objection. I now turn to the matter of the note verbal from the government of Ethiopia addressed to the executive board, copies of which have been provided to members of the board. This is an extremely complicated matter with political implications and outside the agreed procedural framework of this committee. Accordingly, I'm inclined to the view that this request should be set aside with respect to the board and, if appropriate, addressed by those concerned as they may deem appropriate. As I take it that this view is acceptable, let us proceed accordingly, and we move now to our next item, the adoption of the agenda. Thank you very much for your understanding. Let's now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda contained in documents EB 150/1 and EB 150/1 annotated. In accordance with the Rule 8 of the Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 30th September 2021 to review the draft provisional agenda of the 150th session of the board that had been circulated to member states on 30th June 2021. Proposals received from member states by the deadline of 22nd September 2021 were considered. You will find the details of the consultation and the recommendations on pages 9 to 12 of the English version of the document EB 150/1. I would like to propose the deletion of the following agenda items, as I understand that they are not needed. Item 6.3, modalities of the second candidates forum. Item 19.6, amendments to the financial regulations and financial rules. And the second bullet point on membership under item 22.2, the Independent Expert Oversight Advisory Committee. May I take it that this proposal is acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? Thank you. The agenda is therefore decided. Oh, Franz, I can see your nameplate is up. You have the floor, please.
Thank you, Chair. It's not about the adoption of the agenda, it's a general comment. So, Mr. President, Mr. General Director, dear member of the Executive Council, chers collègues, pardon, I switch in French. L'Union européenne travaille en étroite collaboration avec l'Organisation mondiale de la santé sur un large éventail de sujets, tant dans la région européenne qu'au niveau mondial. Et comme convenu dans les échanges de lettres en 2000 entre l'OMS et la Commission européenne concernant la consolidation et l'intensification de la coopération, et sans préjudice de toute conclusion future d'un accord général entre l'OMS et l'Union européenne, la délégation de l'Union européenne assiste aux réunions du Conseil exécutif en tant qu'observateur. Comme lors des précédentes réunions du Conseil exécutif, nous demandons au Conseil exécutif de bien vouloir accepter que la délégation de l'Union européenne soit également invitée à assister et à participer sans droit de vote aux délibérations des réunions des sous-comités et des comités, groupes de rédaction et autres subdivisions traitant de questions relevant de la compétence de l'Union lors de la 150e session du Conseil exécutif. Merci.
Are there any proposals are there any objections to France's proposal? I see none. Thank you. The method of work and daily timetable. As you know, EB 150 has a heavy agenda with 55 items and sub-items and more than 20 draft resolutions and decisions to be examined. It is important that we hold the meetings in a constructive manner. I would like to inform you, as discussed by the Executive Board members during the informal EB retreat, EB members are encouraged to be concise when taking the floor. However, they will not be required to adhere to specific time limits. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of United Nations and other participating intergovernmental organizations and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. I would also like to inform you that, as agreed, constituency statements by non-state actors in official relations will continue to be trialed during this meeting and will be provided on the following selected agenda items. Pillar 2, items 15.3, WHO's work in health emergencies, and 15.5, Global Health for Peace Initiative, which are being taken together. Then Pillar 3, item 17, on maternal, infant, and young child nutrition. Pillar 4, item 19.3, on sustainable financing. Constituency statements will be limited to 3 minutes and will be delivered after all EB members intermingled throughout the discussions. When we move the agenda items considered last week
Lorsque nous
by the
passerons au point
PBAC,
de l'ordre du jour examiné
I
la semaine dernière par le
propose
PIBAC,
to build on the good
je vous
work
propose
of that
de nous
committee
appuyer sur
by
l'excellent
focusing our
travail effectué
discussion
par ce comité
on the PBAC
en
report
centrant
and
nos
its
discussions sur
recommendations
le rapport du
rather
PIBAC et
than
ses
having
recommandations
another full
plutôt que
discussion
d'ouvrir une
of
autre
each of the
discussion
documents.
complète sur chacun des documents.
May I take it that these
Puis-je
proposals
considérer
are
que vous
acceptable?
pouvez accepter ces propositions?
I see no objection.
Je ne vois pas
It is so
d'objection. Il en
decided.
est ainsi décidé.
I propose
Je vous
that the board
propose
meet
que le Conseil se réunisse de 10
10
heures
to
à
13
13
hours
heures
and from 14
et de
hours,
14 heures à
17
17
hours
heures,
Geneva
heure
time.
de Genève.
Let us now review the
Examinons maintenant
preliminary
le
daily timetable contained in document
calendrier quotidien
EB
préliminaire
150
contenu dans le document
div/2.
EB 150 div
Today, after
bar
our
2.
consideration of item 2, report
Aujourd'hui,
by the
une fois que
Director
nous aurons
General,
examiné le point 2,
we will turn
rapport
to
du
item
directeur
3,
général, nous passerons
outcome
au
of the
point
second
3,
special session of the
résultat
World Health
de la
Assembly,
deuxième
held
session
to
extraordinaire
consider
de
developing
l'Assemblée mondiale de
WHO
la santé
convention,
qui
agreement,
a eu lieu
or
pour
other
examiner
international instrument
l'élaboration d'une
on pandemic
convention,
preparedness
d'un
and
accord ou
response.
d'un autre instrument
Then
international
item
de
4,
l'OMS sur la préparation
report of the
et la
regional
riposte aux pandémies.
committees
Puis,
to the
nous
Executive
examinerons
Board.
le point 4, rapport des comités régionaux au Conseil
When
exécutif.
we move on to the
Lorsque nous
technical
aborderons les
and health
points
items,
techniques et
we
les
will
questions
start
liées à la
with
santé,
Pillar 2,
nous
1
commencerons
billion
par
more
le
people
pilier 2.
better protected from health emergencies,
1 milliard
and
de
take up
personnes
together
supplémentaires bénéficiant de la
sub-items
couverture sanitaire
15.1,
universelle.
strengthening
Et nous
WHO preparedness
examinerons
for
les
and
points
response to health
15.1,
emergencies,
renforcement de la
and
préparation et de la riposte de
15.2,
l'OMS
the
aux
Standing
urgences
Committee
sanitaires,
on pandemic and
le
emergency
point
preparedness and
15.2,
response.
commission permanente de préparation et de riposte aux
On
pandémies et aux
Tuesday,
situations d'urgence,
25th January
conjointement.
2022,
Le 25
at 10
janvier
hours
2022 à 10 heures,
CET, the board will turn
le
to item
Conseil
6, post
examinera
of
le
Director
point
General.
6, poste de
On Tuesday
directeur
afternoon,
général. Mardi
we
après-midi,
will consider
nous
item 5,
examinerons le point 5,
report of the
rapport du
program
comité du
budget
programme du
and
budget et
administration
de
committee
l'administration du Conseil
of the
exécutif.
Executive Board, followed by sub-item 19.3,
Il sera suivi
Sustainable
par le point
Financing
19.3,
report of the
financement
working group.
durable, rapport du groupe de
We shall
travail.
then turn to Pillar 1,
Ensuite, nous nous pencherons sur le
followed by the
pilier 1,
remaining
qui sera
items
suivi par les points
under
restants
Pillar 2, Pillar
sous les
3,
piliers 2,
and Pillar
3
4,
et 4,
as described in the
tels que
preliminary
décrits dans l'emploi du
daily
temps quotidien
timetable in
préliminaire qui
document
figure dans le
EB
document EB 150/div/2.
150/2. Item
Le point
20.1,
20.1,
prevention of sexual
prévention de
exploitation,
l'exploitation sexuelle, des
abuse
abus
and
sexuels
harassment
et du
will
harcèlement
be taken
sexuel
up
sera examiné
on
vendredi
Friday,
28
28
janvier
January 2022
2022
at
à
1400 hours.
14 heures.
I understand that the proposed grouping of the items under
Je
each
crois
pillar
savoir que
has
les
been shared.
regroupements de points proposés sous chaque pilier ont été communiqués.
And I would also want to confirm
J'aimerais
that
confirmer
the agenda
par ailleurs
is adopted.
que l'ordre du jour est adopté.
Do I take it that the board
Puis-je
agrees with these
considérer que le
proposals?
Conseil est d'accord avec les propositions que je viens d'énoncer?
As I see no objection, it is
Puisqu'il
so
n'y a pas
decided.
d'objection, il en est
I
ainsi
would like
décidé.
to draw the attention
J'aimerais appeler
of
l'attention des
participants on the
participants
virtual
sur la plateforme
platform,
virtuelle
the guidance provided by the Secretariat
sur les orientations
regarding
et
correct
conseils
equipment.
fournis par le
In
secrétariat
particular,
concernant
I
un
would
bon
like
équipement.
to remind all
J'aimerais en
speakers
particulier
of the
rappeler à
request
tous les
use
intervenants la
a full
demande qui leur a
headset
été faite
with inbuilt
d'utiliser un
microphone
casque
when speaking.
avec microphone incorporé
Headsets are
lorsqu'ils prennent la
important
parole.
to assure
Les
the best
casques sont
possible
très importants pour
sound
garantir
quality
la meilleure
for all
qualité de son
participants,
possible pour tous les
and
participants
especially
et
to
tout
ensure
particulièrement
optimal
pour
sound
garantir une
quality
qualité de
for
son
the
optimale
interpreters
pour les
who
interprètes
need to be
qui
able
ont
to
vraiment
hear
besoin
clearly
de
in
vous
order
entendre
to
clairement
interpret
pour
your
pouvoir
statements
interpréter vos
accurately.
déclarations de manière fidèle et
Please note
exacte.
that only
Veuillez
speakers
noter que seuls
present
les
in the
orateurs
meeting room
présents dans la
do
salle
not need
n'ont pas
headsets
besoin de
for
casque
speaking
pour prendre la parole,
simply
tout
because they
simplement
have the
parce
benefit
qu'ils ont
of microphones
l'avantage
that feed
de
sound
pouvoir
directly
utiliser des
to the
microphones
interpreters. Your
qui
compliance with this request
transmettent le son
is highly
directement aux
appreciated.
interprètes. Nous
When
apprécierions
delivering
grandement
statements,
que vous
I would
respectiez
like
cette
to remind
demande.
delegates
Lorsque vous
speak
prendrez la parole,
at a
j'aimerais vous
moderate
rappeler
speed
de parler à
that
une
allows
vitesse modérée
for its
qui
interpretation
permet
and
l'interprétation
ensures
et
their
qui
message
permet
is
également de
conveyed
veiller à ce que le message
clearly and
soit
accurately.
transmis clairement
Please send a copy
avec
of your written statements
précision
in
et
advance to the
exactitude.
email address
Veuillez
interpret
donc envoyer à l'avance un exemplaire de votre déclaration écrite à l'adresse
This
email
does not prevent you from making
interpret@who.int.
changes
Cela ne nous
delivery,
empêchera pas
but will
de modifier
facilitate
votre
clarity
intervention lorsque
and
vous la ferez
accuracy
en
in
direct.
all
Mais
languages.
cela facilitera la clarté
If
et la
you would like your
précision dans
statement
toutes les langues.
to be posted
Si
on
vous
the
voulez que
WHO
votre
website,
déclaration soit
or
affichée
if
sur
you
le
have a
site web de
longer
l'OMS,
statement
ou si vous
with
avez une
information
déclaration plus
you
longue
would like to
qui
share
contient
additionally,
des informations que
you
vous
may
souhaiteriez
send it
partager,
to the
vous
email
pouvez
address
l'envoyer à l'adresse email statements@who.in.
Please note that
Veuillez
written
noter
statements
que les déclarations
will not be
écrites
included
ne seront
in the
pas
summary
incluses
record
dans
of the meeting.
le compte-rendu récapitulatif
This
de la réunion.
concludes our consideration of agenda
Voilà
item
qui nous
1.
amène au terme de l'examen de
Now
ce
let's
premier
turn
point de l'ordre du jour,
The
le point
next
1.
agenda item.
Passons tout de suite au point suivant de l'ordre du jour.
Let us consider item 2 of our agenda,
Passons
the
maintenant au
report by
point
the
2 de
Director
notre ordre
General,
du jour, rapport du
and I
directeur
have the
général.
pleasure in giving the
J'ai
floor
le plaisir
to the Director
de donner
General.
la parole au
Dr.
directeur
Tedros,
général,
you
Dr
have the
Tedros.
floor.
Vous avez la parole.
There's a glimpse of hope we all know. There's a darkness where light needs to show. I'm searching for a way, oh, hoping for answered prayer, waiting for the flame of love to share.
We gather here, knowing who we are, holding hands and standing with open hearts, and reaching to a place where there are more to say. Better life will make a better place. Glory of my soul, let it shine. We are united with faith and love.
Let it shine wherever heart could see.
Keep the light, the light of love.
Glory of my soul,
Let it shine.
we are united with faith and love.
Let it shine.
Let it shine, heart could see. Keep it high.
Thank you. The video was
Merci.
played in relationship
Cette
to my
vidéo
earlier comments regarding
faisait
the
référence aux
volcanic
commentaires
eruption
que
in Tonga and
j'ai
the
fait tout à
subsequent
l'heure au sujet de
tsunami,
l'éruption volcanique au
and of
Tonga et le
course our
tsunami qui s'en est
solidarity with
suivi.
the people of Tonga.
Et bien sûr,
I
c'est un
have the
signe de
pleasure in giving the
solidarité
floor
pour
to the
le
Director
peuple des
General,
Tonga.
Dr. Tedros.
J'ai le
Dr.
plaisir de donner
Tedros,
la
you have the
parole
floor.
au directeur général, le Dr Tedros.
Thank you, Your Excellency.
Merci beaucoup, Excellence.
It was the right thing actually to start with
En fait, c'est bien de commencer
the
ainsi
nurses choir,
avec
nurses
le
from
cœur des
Tonga.
infirmiers et des infirmières des Tonga.
I visited the hospital, Viola Hospital, when I
Je me
visited
suis
Tonga in
rendu
2019.
à
And I
l'hôpital
met
Viola
these,
lorsque
nurses
j'étais au
in
Tonga
person.
en
I
2019 et j'ai
was
rencontré
impressed
ces infirmières et ces
by,
infirmiers en personne et j'étais
their,
impressionné
songs, the choir.
par leurs
It's
chansons,
part
par leur
of the
cœur.
healing process,
En
by
fait,
the way,
cela fait
for their
partie du
patients.
processus de guérison de leurs
They help
patients.
the patients
Ils aident les
through
patients
singing with the
par leur
patients and so
chant.
on.
Ils chantent avec
So I'm
eux.
glad to start really with that.
Donc, je suis vraiment heureux de commencer
Our
avec ces
heart
images.
is with Tonga.
Et
Of
notre
course, I
cœur
have
est avec les
something to
Tonga.
say later.
Et je dirai
Your
encore
Excellency,
d'autres
Dr.
choses à ce
Patrick
sujet
Amor, the chair
plus
of
tard.
the Executive
Excellence, Dr.
Board,
Patrick Amos, président du
Excellencies,
Conseil exécutif,
regional
Excellences,
directors,
Mesdames et
dear
Messieurs les
colleagues
directeurs
and
régionaux,
friends.
chers collègues, chers amis.
Good morning to all EB members
Bonjour à
who
tous
have
les
joined
membres
us
du
here
Conseil
in
qui
Geneva,
nous ont rejoints
and
ici
good
à
morning,
Genève, et
good afternoon and
bonjour
good
ou
evening to all
bonsoir
member
à tous ceux
states,
qui nous suivent,
participants and observers online.
participants, observateurs
Happy New
en
Year to
ligne.
you all.
Bonne année à vous tous.
I welcome the new members of the board.
Je salue les nouveaux membres
As
du
the chair
Conseil.
said,
Comme l'a dit
we
le
send our
Président,
deepest
nous
condolences
adressons
and
nos plus
concern,
vives
our
condoléances
warmest
et faisons
greetings and our best
part de
wishes
notre
to our sisters
préoccupation
and
tout
brothers
tout
in
en
Tonga,
envoyant
who
nos
are facing
meilleurs souhaits
difficult
à nos
days
camarades
as they
des
respond to
Tonga
last week's volcanic
qui
eruption
doivent faire face
and
aux
tsunami.
conséquences de
As we
l'éruption
speak,
volcanique et du tsunami de
WHO
la semaine dernière.
is
À l'heure où
working
je
with
vous
our
parle,
partners
l'OMS travaille avec
to
nos
support
partenaires
the response,
pour
providing medical
soutenir la
expertise
riposte,
and
pour
supplies.
fournir des compétences
A national
médicales et des
emergency medical
fournitures.
team trained
Une
by
équipe médicale
WHO
d'urgence
was
formée
deployed
par l'OMS
almost
a été déployée
immediately
quasiment
following the
immédiatement
eruption.
après
And we're
l'éruption.
supporting them with
Et
medical
nous les aidons
items,
avec
first aid
des
kits,
articles, des produits
tents,
médicaux,
portable
des kits
toilets,
de première
and water
urgence,
filtration
des
equipment.
systèmes, des équipements de filtration de
Our
l'eau, des produits
country
d'hygiène.
our country liaison officer,
Pays,
Dr.
nos bureaux de
Yutaro
pays, nos
Setoya,
officiers de
is playing a
liaison,
crucial
en
role in
particulier Dr.
channeling
Setoya,
communication
jouent un
between
rôle
the UN
primordial
agencies,
en facilitant la
humanitarian
communication entre les
partners,
institutions des Nations
and the
Unies, les
government,
partenaires
including
et
through the
les
use
gouvernements,
of
notamment
WHO
grâce à
satellite phone,
l'utilisation
which was
du
one
fonds
of the few
satellite de
ways to
l'OMS,
get
qui est l'un
information
des
in and
moyens
out of the
d'obtenir
country
des
in the first
informations,
few days
qui a été l'un
after
des
the
moyens d'obtenir
eruption.
des informations du
So my
pays dans
appreciation
les jours qui
to
ont
our
suivi
country
immédiatement
office
l'éruption.
and
Donc,
also
merci
to our
au
regional
bureau de pays
director
et à notre
Takeshi Kasai, who is
directeur
with us
régional
today.
Takeshi qui est avec nous aujourd'hui.
This Sunday marks 2
Dimanche,
years
ce dimanche
since
a
I
marqué
declared the public
la
health emergency
deuxième
of
année
international
de
concern,
déclaration de
the highest level of
situation
alarm
d'urgence
under
publique
international law
internationale.
over the spread of
Et ce face à la
COVID-19.
propagation de la
At the same
COVID-19.
time,
Dans le même temps,
At the time, there were fewer
il y avait
than
à
100
l'époque
cases
moins de
and no
100
deaths
cas
reported outside China.
et aucun décès en
2
dehors
years
de
later,
Chine. 2 ans
almost
plus tard,
350 million cases have
presque
been reported
350 millions de cas
and
ont
more
été
than
signalés et plus
5.5
de
million
5,5
deaths.
millions de décès
And we know these
enregistrés.
numbers
Et nous
are
savons que ces
underestimated.
chiffres sont sous-estimés.
On average,
En
last
moyenne,
week,
la semaine dernière,
100 cases were
100
reported
cas
every
ont
3
été
seconds.
signalés toutes les 30
And
secondes. Et
somebody
toutes les 3
lost
secondes.
their life to COVID-19
Et il
every
y a
12
des gens
seconds.
qui ont perdu la vie à cause de la
Since
COVID-19
Omicron
toutes les
was
12
first
secondes.
identified
Depuis
just
qu'Omicron a
9
été
weeks
identifié la
ago,
première fois, il y a 9
more
semaines
than
exactement,
80 million
plus de
cases
80 millions
have been
de cas
reported to
ont été
WHO.
signalés à l'OMS.
More than were reported in the whole of 2020.
Plus que pendant toute l'année
So far,
2020.
The explosion in
Jusqu'ici,
cases has
l'explosion
not been
de
matched
cas
by a surge in deaths.
n'a
although
pas fait
deaths
l'objet
are
de
increasing in all
beaucoup
regions,
de recherches,
especially in
bien que ces
Africa,
recherches s'accroissent dans
the
toutes les
region
régions,
with the
y
least
compris en
access
Afrique,
to
la région
vaccines.
qui a le moins d'accès aux vaccins.
So, where do we stand?
Alors, où en sommes-nous?
Where are we headed?
Où allons-nous?
And when will it end?
Et quand est-ce que
These
cela
are
sera
the
fini?
questions many asking.
Voilà les questions que beaucoup
It's
se
true
posent.
that we will be living with COVID
Il est vrai
for
que
the
nous
foreseeable
vivrons avec
future,
la Covid dans un
and that we will
avenir
need to learn
proche et
to manage it
prévisible,
through a
et que nous
sustained and
devrons
integrated
apprendre à
system
vivre avec
for
et à
acute
gérer
respiratory
grâce à un
diseases, which
système
will
intégré,
provide a
notamment
platform
pour les
for
malades
preparedness
respirateurs
for
aigus,
future
qui
pandemics.
tout cela nous permettra également de
Learning
nous
to live with
préparer
COVID
aux prochaines
cannot
pandémies.
mean
Mais
that we
apprendre à
give
vivre
this
avec la
virus
Covid ne
a
veut
free
pas
ride.
dire que nous allons laisser ce
It cannot
virus
mean that we accept
circuler
almost
librement.
50,000 deaths a week
Nous
from
ne
a
pouvons pas
preventable
accepter
and
50 000 décès
treatable
par semaine
disease.
alors que nous sommes en présence d'une
It cannot
maladie
mean
qui
that
est
we
évitable
accept
et
an unacceptable burden on our health systems
guérissable. Nous ne
when
pouvons pas
everyday
accepter cette
exhausted
charge
health
sur nos
workers
systèmes
go
de
once
santé,
again
alors
to the
que
front
chaque
line.
jour, des agents de
It
santé
cannot
épuisés
mean
se
that we
retrouvent
ignore
encore
the
en
consequences
première
of long
ligne.
COVID,
Nous ne pouvons
which
pas
we
ignorer les
don't yet
conséquences
fully
à long
understand.
terme de la Covid. Ces Covid
It
longs que
cannot
nous ne
mean that
comprenons
we
pas
gamble on a
parfaitement.
virus whose
On ne
evolution
peut
we
pas
cannot
miser
control
et jouer avec
nor
un vaccin qu'on ne
predict.
peut pas ni contrôler ni
There are
prédire.
different scenarios
Il y a
for
différents
how the
scénarios
pandemic could play out
concernant
and how the
l'évolution de la
acute
pandémie
phase could end.
et la façon dont cette phase aiguë
But it's
pourrait prendre
dangerous to
fin.
assume that
Mais il est
Omicron will
dangereux
be the
de
last
penser
variant
qu'Omicron
or that we
serait le
are
dernier
in the
variant
endgame.
ou que nous en sommes vraiment à la toute
On the
fin de
contrary,
cette course. Au contraire,
globally, the
à
conditions
l'échelle
are
mondiale,
ideal
les
for
conditions
more
sont idéales
variants
pour
to
que
emerge.
d'autres variants apparaissent.
To change the course of the pandemic,
Pour
we
modifier
must
le cours
change
des
the
choses et de la
conditions
pandémie,
that
nous
are
devons
driving
changer
it.
les facteurs.
We recognize that
Nous
everyone is
reconnaissons
tired of
que
this pandemic,
chacun est
that
fatigué
people
de
are
cette
tired
pandémie,
of
que tout le monde
restrictions
est
on their
fatigué des
movement,
restrictions,
travel,
restrictions de
and
mouvement,
other
de voyage
freedoms,
et autres.
that economies and businesses
Les
are
économies,
hurting,
les entreprises
and
sont
that
mal en point.
many
Et
governments are
beaucoup de
walking a
gouvernements
tightrope,
travaillent
attempting
sans
to
cesse
balance what
pour
is
essayer
effective
de
with
trouver
what is
l'équilibre entre ce
acceptable
qui est
to their
efficace
people.
et ce qui est acceptable pour
Each
les
country is
populations.
in a unique situation
Chaque pays se retrouve dans une
and
situation
must
unique
chart its way out of
et
the
il
acute
doit
phase of the
trouver
pandemic
la façon la
with
plus
a
appropriée
careful,
de sortir de la phase aiguë
stepwise
de la pandémie
approach.
de manière progressive sur
It's
la base
difficult,
d'une approche
and there are
sage.
no easy
C'est
answers,
difficile et il n'y a pas
but
de
WHO
réponse facile.
continues
Mais
to
l'OMS
work nationally,
continue de travailler à
regionally,
l'échelle nationale,
and globally
régionale et
to provide
mondiale
the evidence,
pour
the
fournir
strategies,
des données
the
probantes,
tools, and the
pour
technical and
fournir des
operational support
stratégies, des
countries need.
outils et un appui technique
If
dont ont besoin les
countries
pays.
use all of
Si
these
les pays
strategies and
utilisent toutes ces
tools in a
stratégies et tous ces
comprehensive
outils
way,
d'une manière
we
globale,
can end the
nous
acute
pourrons
phase
mettre
of the
fin à la
pandemic
phase aiguë
this
de
year.
la pandémie cette année.
We can end
Nous
COVID-19
pouvons
as a
mettre un
global
terme à la
health
COVID-19
emergency,
en tant
and
qu'urgence de
we can
santé
do it
mondiale
this year.
et nous pouvons le faire cette année.
What does that look like?
Comment se présente
It
la
means
situation?
achieving our target to
Cela
vaccinate
signifie qu'il faudra
70% of the
réaliser notre
population
objectif
of
consistant
every
à vacciner
country
70%
with a
de la
focus on the
population de
most
tous les
at-risk
pays
groups.
en ciblant tout particulièrement les groupes les
It
plus
means
exposés à
reducing
des risques. Cela
mortality
signifie
through
réduire la
strong clinical
mortalité
management,
grâce à
beginning
une
with
gestion
primary
clinique
health care
rigoureuse
and
des soins de
equitable
santé
access to
primaire
diagnostics,
renforcés et un
oxygen,
accès
and
équitable aux
antivirals
outils de
at the
diagnostic, à
point
l'oxygène,
of care.
aux anti
It means
aux antiviraux.
boosting testing and
Cela
sequencing
signifie qu'il
rates
faut stimuler
globally
les taux de dépistage,
to
de
track
tests
the
à l'échelle
virus
mondiale
closely
pour tracer le virus
and monitor
de
the
près
emergence
et
of
suivre
new variants.
l'émergence de nouveaux variants.
It means the ability to calibrate
Cela
the
signifie
use
qu'il
of
faut
public health and
pouvoir
social measures
calibrer
when
les
needed.
mesures sociales
It
et les mesures
means
sanitaires lorsque
restoring
cela est
and
nécessaire,
sustaining essential
rétablir
health services.
des services de santé
And it means
essentiels
learning
et
critical lessons
apprendre,
and
tirer des
defining
enseignements
new solutions
critiques et
now,
définir
not
maintenant de
waiting
nouvelles
until
solutions
the
sans
pandemic
attendre que
is
la
over.
pandémie soit terminée.
We can only do
Nous ne
this with
pouvons le
engaged
faire
and empowered communities,
qu'avec des communautés
sustained
engagées,
financing,
autonomisées,
a focus
un
on
financement
equity,
durable, en
and
mettant l'accent sur
research
l'équité et
and
la
innovation.
recherche et l'innovation.
Vaccines alone
Les vaccins
are not the golden ticket out of
ne
this pandemic.
seront pas la
But there
panacée
is no
pour
path
sortir de la
out
pandémie.
unless we achieve our shared target of
Mais nous
vaccinating
devons
70% of the
vacciner
population of every
70%
country
de la
by
population
the
de
middle
chaque pays
of this
d'ici
year.
au milieu de cette année pour
We have
parvenir à
a long
ces
way to go.
objectifs. Donc nous avons beaucoup de chemin à
As it
parcourir.
stands, 86
Dans la
member states
situation
across all
actuelle,
regions have not been able to
86
reach
États
last
membres
year's target
n'ont
of
pas
vaccinating
pu
40% of their
remplir
populations.
l'objectif que nous étions fixé l'année dernière,
And
40%
34
de
member
vaccinés.
states, most
Et
of them
34
in
États
Africa
membres, surtout
and the
en
Eastern
Afrique
Mediterranean
et dans la
region,
région de la Méditerranée
have
orientale,
not been
n'ont
able to
pas
vaccinate
réussi à
even
vacciner
10%
même
of their
10%
populations.
de leur population.
85% of the population of
85% de la
Africa
population
is
du
yet to
continent
receive
africain
a
doit
single dose
recevoir
of vaccine.
une première dose de vaccin.
How
Cela
can
n'a pas
this be
été fait
acceptable to any of
Comment
us?
Pouvons-nous accepter une
We
telle
simply
situation?
cannot end the emergency
Nous ne
phase
pouvons
of
pas
the
mettre un
pandemic
terme à la
unless
phase
we bridge
d'urgence
this
de la
gap.
pandémie à moins de combler ces
But we
lacunes.
can bridge it,
Mais nous pouvons le
and
faire
we're making progress.
et nous progressons.
Just a week ago,
Il y a une
COVAX
semaine,
delivered
le
its 1
COVAX a
billionth
fourni
dose.
sa
In the past 10
milliardième
weeks,
dose.
COVAX
Les
shipped
10
more
dernières semaines, le
vaccines
COVAX
than
a envoyé
in the
plus de
previous
vaccins
10
qu'il ne l'avait
months
fait au cours des
combined.
10 mois précédents.
The challenge of supply we have
Combiné,
faced in the
les
past year
difficultés
are now being
d'approvisionnement que nous
replaced
avons
by the
rencontrées l'année
challenge
dernière
of
sont
rolling out
remplacées par des
vaccines as
difficultés
fast
liées au
and
déploiement
far
aussi rapide que
as
possible du
possible.
vaccin.
WHO and our partners are
L'OMS
working
et
with
nos
countries
partenaires
around the
travaillent avec
clock
les pays dans
to
le monde
overcome
entier pour
these
surmonter
challenges.
ces difficultés et ces obstacles.
Excellencies,
Excellences,
colleagues and friends,
chers collègues, chers amis,
the pandemic has been a
la
severe
pandémie
disruption to health
a
systems
fortement perturbé les
economies,
systèmes de santé, les
and
économies
societies
et les
the world
sociétés
over.
dans le monde entier.
And too much of our shared work to advance towards the triple billion targets
Pour
of the
progresser
13th
vers
General
le triple
Program of Work.
milliard du programme
For that
général
reason,
de travail,
The Secretariat
nous
is proposing a
devons
2-year
travailler
extension of
et
the
nous
GPW to
proposons
2025
à cet
to
effet
give
une
us all a
prorogation de
chance to
2
get
ans
back
du
on track,
13e
apply the
programme
lessons
général
of
de
the
travail
pandemic,
pour que nous puissions tirer
intensify
les enseignements de la
investment,
pandémie,
and
intensifier les
accelerate
investissements
progress.
et accélérer les progrès.
Even before the pandemic,
Même avant la
the world
pandémie,
was off
le
track
monde
for the triple billion
n'était
targets.
pas
Now,
sur les rails
we're
pour ce
even
qui est du
further
triple milliard. Et
behind.
là, nous sommes encore plus à la
That's
traîne.
particularly the case for our target to see 1
particulièrement
billion
le
more
cas
people benefiting from universal health coverage.
Pour l'objectif suivant, un
As a
milliard
result
de
of the
personnes
pandemic,
supplémentaires
we could now be
bénéficiant de la
facing a
couverture
shortfall of
sanitaire.
up to 840
Nous
million
pourrions
people, mostly in
avoir,
lower income
840
countries.
millions de personnes en
More
moins
than
par rapport à
90%
notre
of countries
objectif,
continue
surtout dans les
to
pays
report
les moins
disruptions
avancés.
to one
Et il y a
or
des
more
perturbations
essential health
pour
services.
un ou plusieurs services sanitaires
The most
essentiels
recent
dans
WHO
nombre de
Global
pays.
Monitoring Report on UHC shows that while service coverage has
dernier
improved over the last
rapport
20
montre
years,
que la couverture
about
des services
half the
s'est
world's
améliorée.
population still lacks
Depuis 20 ans,
access to
mais
essential
La moitié de
health
la population du
services.
monde n'a pas accès
And the
aux services de
proportion of
santé
people facing
essentiels.
financial
Et la
hardship
part de
due to
personnes
out-of-pocket
ont des problèmes
spending
financiers en
has
raison de
increased.
dépenses personnelles pour la santé
But
a augmenté.
Despite
Mais
the ravages of the
malgré
pandemic,
les ravages
we
de la
are
pandémie,
demonstrating that with the right strategies and the
montrons
right
qu'avec les
tools,
bonnes stratégies,
we
les
can
bons
bring some of the
outils,
world's oldest
nous
infectious killers under
maîtriser
control.
certains des tueurs
On communicable
infectieux
diseases,
les plus anciens.
2021
Pour ce
was
qui
a
est des
historic
maladies
year,
transmissibles, 2021 était
with the
une
WHO
année
recommendation
historique.
for widespread use
Compte tenu
of
de
the world's
la
first
recommandation
malaria
de
vaccine,
l'OMS concernant
which could save tens of
l'utilisation
thousands of
généralisée
young
du
lives
premier
each
vaccin
year.
contre le paludisme, mais qui pourrait sauver des dizaines
China
de milliers
and
de
El
jeunes
Salvador
filles
were
chaque année.
certified
La
by
Chine et
WHO as
le
malaria-free
Salvador
last year,
ont été vaccinés comme étant
and the
exemples.
Islamic Republic of
paludisme
Iran
l'an dernier
recorded
et
3 consecutive years of zero
la République
indigenous
islamique,
cases of malaria.
d'Iran. A
8
enregistré
countries
la
achieved
troisième
the
année, sans cas
90 targets for
autochtone.
testing, treatment access, and viral suppression
pays
of HIV by the end of 2020.
ont accompli des progrès
And a further
concernant
20 countries are
le
close.
VIH et d'autres pays
With support
sont
from
proches.
WHO,
Avec l'aide
15
de
countries
l'OMS,
have eliminated mother-to-child transmission of
15 pays ont
HIV
éliminé la
and
transmission
or
de la
syphilis in
l'enfant
2021.
du VIH ou de la syphilis
Botswana
en
became the
2021.
first
Botswana
high
est
burden
devenu
country in Africa
le
to
premier
achieve
pays en
silver
Afrique
tier
à
certification on
obtenir
the
la
path to elimination of
certification
mother-to-child transmission of HIV.
pour ce qui est de la transmission du VIH.
Elimination of hepatitis B and C as a public health threat in 5 countries: Brazil, Georgia, Mongolia, Rwanda, and Thailand, with several other countries nearing validation, including Egypt. Despite the disruptions of the pandemic, 86 countries globally achieved the end-TB strategy milestone for 2020 of reducing TB incidence. With WHO support, 5 countries eliminated a neglected tropical disease. Gambia and Myanmar eliminated trachoma. Cote d'Ivoire and Togo eliminated human African trypanosomiasis. And Malawi eliminated lymphatic filariasis. Only 14 cases of guinea worm disease were reported last year from 4 countries, taking us ever closer to the eradication of this ancient disease. And only 5 children were paralyzed by wild polio virus, the lowest level we have ever achieved. We now have a real opportunity to eradicate wild polio once and for all this year, and move towards a sustainable transition in countries that are now polio-free. So for polio eradication, this is the opportunity. In November, the first truly nationwide polio vaccination program in several years was conducted in Afghanistan, protecting more than 2.6 million previously inaccessible children. On non-communicable diseases, we launched a new global breast cancer initiative to reduce mortality by 2.5% every year until 2040, saving 2.5 million lives. We launched the Global Platform for Access to Childhood Cancer Medicines, a $200 million initiative to provide quality-assured medicines to 12 low and middle-income countries. As you know, in high-income countries, childhood cancer survival is over 80%, while in low-income countries, it's under 30%. We will do everything to narrow this gap. To support our global strategy to eliminate cervical cancer, we pre-qualified a 4th HPV vaccine for cervical cancer to increase access and decrease prices, and several more countries have introduced HPV vaccines into national immunization schedules, including Cameroon, Cape Verde, El Salvador, Mauritania, Qatar, Sao Tome and Principe, and Tuvalu. And we're working with 120 countries to strengthen, integrate interventions for hypertension, diabetes, and other NCDs into primary health care. COVID-19 has taken a heavy toll on mental health and laid bare the gaps in services around the world. WHO is supporting many countries to expand access to services, including Bangladesh, Jordan, Paraguay, Philippines, Zimbabwe, and Ukraine, where we trained health workers in primary care facilities, increasing access to mental health services. Last year, experts in mental health and psychosocial support were deployed to support scaling up of services in 18 countries and territories in response to public health and humanitarian emergencies. WHO is also supporting countries to expand access to rehabilitation services, including Solomon Islands, Nepal, Rwanda, Georgia, Jordan, and Guyana. 2021 was also a landmark year for WHO's work to increase access to medicines and health products. We gave emergency use listing to 10 COVID-19 vaccines, pre-qualified injection devices and therapeutics, and most recently, we recommended 2 new drugs for the treatment of COVID-19. The COVID-19 Technology Access Pool, CTAP, and the Medicines Patent Pool finalized its first licensing agreement for a COVID-19 serological antibody test. We established the mRNA Technology Transfer Hub in South Africa to boost vaccine production on the continent. And more than 100 member states co-sponsored a World Health Assembly resolution on strengthening local production. On antimicrobial resistance, a recent study estimates that more than 4.9 million deaths were associated with AMR in 2019, making it one of the world's leading causes of death. Despite disruptions due to COVID-19, a record 163 countries have responded to the fifth of tripartite AMR country self-assessment survey on the status of their AMR response. The survey shows that less than 1/4 of AMR national action plans are costed and funded, so WHO has piloted and launched a costing and budgeting tool to support the implementation of national action plans on AMR. The Multi-Partner Trust Fund for AMR, established in 2019, is successfully dispersing funds for global and national activities in already 9 countries. 2021 also saw good progress in our efforts to see 1 billion more people enjoying better health and well-being. This area has enormous potential. We estimate that at least half of the global disease burden could be prevented by supporting safer and healthier environments that allow people to make healthy choices and adapt healthy behaviors. Our current estimates suggest that 900 million people will enjoy better health and well-being by 2023, making the GPW target within reach. However, these gains were mostly in high-income countries, and stark and immense inequalities within and between countries highlight the need to read this achievement with caution. Nevertheless, we have many successes to be proud of. Tobacco use continues to decline. In line with the WHO Framework Convention on Tobacco Control, we worked with 90 countries to reduce tobacco use last year and launched a global campaign to encourage at least 100 million tobacco users to quit. 60 countries are now on track to achieving the voluntary global target of a 30% reduction in tobacco use between 2010 and 2025. As part of WHO's initiative to eliminate trans fatty acids from the global food supply, mandatory policies prohibiting the use of trans fats are now in effect for 3.2 billion people in 57 countries. In 2021, best practice policies came into effect in Brazil, the European Union, Peru, Singapore, and Turkey, while India and Philippines became the first lower middle income countries to pass a best practice policy. We have identified 23 countries to implement the Global Action Plan on the prevention and treatment of child wasting, and 57 countries have already reached or are on track to meet the 2025 target of reducing childhood wasting rates to below 5%. For the first time, the Conference of the Parties to the UN Climate Convention, COP26, included a health program in which more than 50 countries committed to strengthening the resilience of their health systems to climate risks and transition towards a zero-carbon healthcare. WHO has already assisted over 30 countries to begin this journey and will further scale this up over the next 5 years. In the past year, new legislation or regulations on the marketing of breast milk substitutes were approved in Burkina Faso, Côte d'Ivoire, Ethiopia, Kenya, Mauritania, Oman, Sao Tome and Principe, and Sierra Leone. More than 23,000 facilities in 182 countries participated in WHO's global campaign on WASH in healthcare, covering over 14 million health workers and 5.4 million beds. Since the launch of the Global Plan of Action on Road Safety in October, at least 28 countries have launched local initiatives with support from WHO. 4 countries established new laws to reduce exposure to lead paint, which causes about 1 million deaths every year. Peru, Morocco, Georgia, and Ukraine, and WHO is working with 40 countries to develop and implement lead paint laws. We hosted the 10th Global Conference on Health Promotion, which endorsed the Geneva Charter for Well-being. We hosted the Small Island Developing States Summit for Health, supporting countries who are almost at risk of the impact of climate change to create climate-resilient health systems and mobilize new resources. Together with our partners in the Tripartite Plus, we established a One Health high-level expert panel to provide policy and technical guidance to the 4 partner agencies. On our $3 billion target to see 1 billion more people better protected from health emergencies, our current estimates are that we will get close to 1 billion, but the pandemic shows we need to be much more ambitious, much better prepared, and improve the way we measure protection against health emergencies. Supporting countries to respond to COVID-19 continues to be the focus of our work at all 3 levels of our organization. But of course, COVID-19 was far from the only emergency last year. We responded to 76 health emergencies, from acute crisis in Afghanistan, DRC, Ethiopia, and Tonga, to multiple outbreaks of cholera, yellow fever, meningitis, and Ebola, to protracted emergencies in Syria, Yemen, and Cox's Bazar. Through the WHO Logistics Hub in Dubai, we have provided almost $50 million of urgent medical supplies to 120 countries. The operation has increased by a factor of 40 in recent years and now includes a state-of-the-art cold chain facility. We have also taken several steps to put in place new mechanisms for future emergencies. Reflecting long-standing mandates from the World Health Assembly to strengthen pandemic preparedness, we established pathfinding initiatives with member states, such as the WHO Hub for Pandemic and Epidemic Intelligence, the WHO BioHub system, and the Universal Health and Preparedness Review, which you will hear more about later this week. These new initiatives are aligned with many of the recommendations from the various reviews and provide a solid foundation for strengthening the global health architecture to manage the risks of epidemics and pandemics. Underpinning all of these achievements is the core business of developing top quality norms and standards for which member states depend on us, and a commitment to strengthen data and health information systems to monitor progress. In 2021, we produced new guidelines, strategies, action plans, and reports across the spectrum of health challenges, from air quality to artificial intelligence, from hepatitis to hypertension, from suicide prevention to sexual and reproductive health, and much more. All of these technical products have been quality assured by our science division, which was established as part of our transformation to ensure we give you, our member states, the highest quality norms and standards, and to translate those products into impact in countries. We also launched the digitalized ICD-11, the $3 billion dashboard, the World Health Data Hub, and more. We use behavioral science to support the pandemic response in Zambia, Nigeria, Malaysia, and other health challenges, from nutrition to antimicrobial resistance and maternal health. We launched the WHO Academy in Lyon. Through the Global Action Plan for Healthy Lives and Well-being for All, 13 partner agencies are collaborating for greater impact in 50 countries in primary healthcare, health financing, data, and more. Excellencies, dear colleagues and friends, ending the acute phase of the pandemic must remain our collective priority. One of the greatest risks now is that we move on to the next crisis and forget the lessons the pandemic has taught us, lessons that have come at a greater price. The most important of these lessons is the centrality of health. COVID-19 is so much more than a pandemic. It is a global crisis that touches every area of life: economics, education, families, employment, business, technology, trade, travel, tourism, politics, security, and so much more. It's a very long list. When health is at risk, everything is at risk. The pandemic is not a byproduct of development, not an outcome of prosperous societies, not a footnote of history. It's the heartbeat, the foundation, the essential ingredient without which no society can flourish. Health is central. Our forebears knew this when they wrote in the constitution of this World Health Organization that the health for all peoples is fundamental to the attainment of peace and security, and is dependent upon the fullest cooperation of individuals and states. That unequal development in different countries in the promotion of health and control of diseases, especially communicable diseases, is a common danger. And that the highest attainable standard of health is one of the fundamental human rights of every human being. This is the vision of this organization was created to fulfill. And that's the vision for which we must continue to strive. We need a new determination, a new ambition, a new hope to fulfill that vision. Of course, the world in which we work and the challenges and opportunities we face are very different from the world in which our Constitution was written. Aging populations in some regions, a youth boom in others, searing inequalities in gender, race, and income that harm health and inhibit access to services, historic levels of migration driven by conflict, poverty and the hope of a better life, and a changing climate with profound implications for the future of health. Our challenge is to reinterpret, revitalize, and reimagine our founding vision for our modern world. Realizing this vision requires a paradigm shift in all countries in how health is seen and how health is financed. Indeed, that's why we established the Council of the Economics of Health for all last year to develop a new vision for the way health is financed. For far too long, health has been compartmentalized and deprioritized nationally and internationally. It's time to recognize that if we fail to invest in health, we fail to invest in the future. The triple billion targets of the 13th General Program of Work and the Sustainable Development Goals on which they are based remain our guide. We have made progress against the GPW, and the transformation has positioned us to deliver, but we have more work to do. In particular, our commitment in the coming year and in the coming 5 years is to dramatically strengthen our ability to deliver results in countries. Let me outline 5 key priorities for the world and for WHO as we move forward. First, to support countries to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing its root causes. The pandemic has demonstrated that we must elevate protecting and promoting health as a top priority with significantly increased investment in countries and at WHO. The highest attainable standard of health does not only mean the highest attainable standard of care. It means keeping people healthy and preventing the need for care. It means true health care, not sick care. It requires empowering and enabling individuals, families, and communities to make healthy choices. And it requires governments to create the conditions in which health can thrive by addressing the root cause of disease that lie outside the health sector, all the determinants of health. In particular, it requires radical action to safeguard the health of the planet on which all life depends, by addressing the existential threat of climate change. Such a shift could cut the global disease burden in half, but it would also offer massive economic gains by reducing the burden on health systems and increasing the productivity of populations. The second priority is to support a radical reorientation of health systems towards primary health care at the foundation of universal health coverage. That means restoring, expanding, and sustaining access to essential health services, especially for health promotion and disease prevention, and reducing out-of-pocket spending. It means focusing on the least served, most vulnerable populations, especially women, children, and adolescents, migrants, and refugees. It means ensuring access to vaccines, medicines, diagnostics, devices, and other health products. And it means investing in a health workforce with the training, skills, tools, safe working environment, and fair play to deliver safe, effective, quality care. The third priority is to urgently strengthen the systems and tools for epidemic and pandemic preparedness and response at all levels, underpinning by strong governance and financing to ignite and sustain those efforts, concerted, connected, and coordinated globally by WHO. The decision by member states at the recent special session of the World Health Assembly to negotiate a convention, agreement, or other international instrument on pandemic preparedness and response is a giant stride forward. We urge all member states to engage in this process constructively. Such an instrument will be a vital tool, but it will not solve every problem. There are many other steps we must take together to strengthen pandemic preparedness and response and the architecture to support it. But this agreement, I hope, will be a generational agreement. That will be a game changer. The fourth priority is to harness the power of science, research, innovation, data, and digital technologies as critical enablers of the other priorities for health promotion and disease prevention, for early diagnosis and case management, and for the prevention, early detection, and rapid response to epidemics and pandemics. The solidarity trials for vaccines and therapeutics and the trials supporting the recommendation for widespread use of the world's first malaria vaccine highlight the key role WHO can play as a convener of research. And the fifth priority is to urgently strengthen WHO as the leading and directing authority on global health, at the center of the global health architecture. To continue our transformation journey to make this organization, your organization, more effective, efficient, and accountable. COVID-19 has proven that health is not just a national issue, it's an international issue. The scale of challenges we face is immense and is reflected by the breadth of your agenda this week. The needs are great, and you are right to have great expectations of your WHO. You're right to expect top quality norms and standards based on the best science. You're right to expect even more results in countries. You're right to expect a robust and coordinated international response to emergencies. You're right to expect enhanced governance, efficiency, accountability, and transparency. You're right to expect the highest standards of conduct, and you're right to expect an organization that has zero tolerance for sexual exploitation, abuse, and harassment. The thousands of talented, dedicated people around the world who are proud to work for this organization share your expectations, and so do I. They're committed not just to meeting your expectations, but exceeding them, and so am I. Just as health workers need the resources and tools to do their jobs, so your secretariat, your WHO, needs the sustainable, predictable, and flexible funds to do ours. So I ask member states to ensure the quality and quantity of your investments match your expectations. Entrust us with the resources to deliver the results you rightly expect. Let me put it plainly. If the current funding model continues, WHO is being set up to fail. The paradigm shift in world health that's needed now must be matched by a paradigm shift in funding the World Health Organization. We must look to the future. We must raise our eyes and our ambitions. What do we want the world to look like in 2030? Or when WHO turns 100 in 2048, we will be 75 next year. We all want a healthier world, a world in which the air people breathe, the food they eat, the water they drink, the conditions in which they live and work nurture health instead of harming it. We all want a safer world in which all countries work together to prevent, detect, and respond rapidly to outbreaks and other health emergencies. We all want a fairer world in which all people can access the health services they need without having to make life and death decisions between paying for care and feeding their families. The world has the resources. It's not because we don't have resources. We all want a world in which science triumphs, over misinformation. Solidarity triumphs over division. And equity is a reality, not an aspiration. How many times have we said equity, equity, equity? It can be a reality. If there is a will, there is a way. If that's the world we want, we must start working for that world now. It will take vision and partnership. It will take negotiation, compromise, and sacrifice. Most of all, it will take hope. Most of all, it will take hope. We are one world. We have one health, and we have one WHO. Thank you so much. Merci beaucoup.
Thank you, Dr. Tedros. The floor is now open, and I would like to request that the Secretariat moderate the discussion. Secretariat, you have the floor.
Thank you very much, Mr. Chair. I recognize the United Kingdom and would like to give the floor to them. The United Kingdom, the floor is yours. Apologies, distinguished delegate. We cannot hear you here in the room. Let's try once more. Please. Distinguished delegate, my apologies. We have difficulty hearing you here in the room, although I see that you're unmuted. Yes? We are ready to try again. The floor is yours. I'm sorry. We shall come back to you in a moment to give a little bit of time to fix this technical challenge. And I recognize Ethiopia. No, apologies. I recognize EB member Kenya. Kenya, the floor is yours, please.
Thank you. You can hear me. Can you hear me?
Let's take the chance. Let's go back again and find that our love was meant to last.
Bye.